So, full disclosure, I am a hardcore Bulls fan, and that is going to make this video a little bit difficult for me. Welcome to Omar Illustrated Health. This is the first video on my new channel, but to be honest, I'm a OG on YouTube. I've been posting since 2006, and honestly, I think this YouTube channel is gonna seriously blow up. So it would really appreciate if I would really appreciate it if you guys were a part of that. And uh, I hate to say it, but subscribe and like the video because if you like what this video is, and you'll probably realize that there's not too much like this. There's a few orthopedic surgeons or doctorates of physical therapy, but honestly, this channel is more like you're gonna sit down with me. My name is Omar, and I'm just gonna talk, and it's not gonna be medical advice or even really hardcore medicine based. This is gonna be more about my interest in just sports injuries, and moving forward, I'll talk about it more. We'll break into Khris Middleton right now, but I just want to give you a heads up. This is my first video, so bear with me, and thank you for watching. So let's go ahead. So Khris Middleton, he sprained his MCL, as you guys saw, and according to some sources, he's been ruled out for the remainder of the first round, and I believe they did that after he got his MRI, so they had a little bit of information, but um, he's gonna be back, guys. He's the only reason they said first round is because the Bucks, their medical staff doesn't think that this series is gonna go more than 5 games. I think that's it. I think if there was a seventh game, I think he would play. So we're just gonna go through it, and I'll show you guys what I'm talking about. So this is the ESPN NBA injury report, and you can see the Bucks have two players. So they still update this during the playoffs, even though there are some non-playoff players on here. So Khris Middleton, small forward, April 21st. He's out, and look at this. Not a comment. They didn't comment on what they saw in the MRI or nothing. So let's check out the only really official reporting we have on this. So Woj and Shams, I think, broke the story that he has an MCL sprain and will miss the rest of the first round series versus Chicago. And I think this sentence is key because this is telling us, oh, he'll be back. And yeah, I mean, I do think that he will be reevaluated in 2 weeks. It means that in the break between first round and second round, they're going to reevaluate him. That's what I really think this means. So, and let me show you guys why I'm saying this. So, I have the video of the injury right here, so you can kind of let's go back a little bit. So you can see here. I'm just gonna pause it, and so he kind of just fell on his own accord. And there was no like. Usually, what happens in an MCL tear is somebody will get pushed from the outside of the knee. Kind of like this MCL sprain on Steph Curry. You see how this was traced out by another doctor, but this was traced out to show you that this is the angle of that knee. And but what happens? Look at there's somebody that landed on this knee here, and in this tear, somebody's kind of like kicking or putting force into the outside of the knee towards the middle of the knee. And so that didn't really happen here. You can kind of see it like there wasn't a ton of force. It was just his body weight. It's really quick, a second, and it's just his body weight pushing him down. And then another reason I said that is if you go forward in time, you can see him walking out, and check this out. So he's bearing weight, which means that he can lift his weight on that leg. Look, it's the left leg, right? So this right leg is up. It's all the way up. And look at he didn't even change his gait. And these NBA players, they're dealing with constant injuries. Case in point, Khris Middleton, December 14th, 2021, this season dealt with an injury of the left knee. And so check it out. Bang! The left knee moved backwards. Let me just do it one more time so you can see it. So it's the same knee he injured this week. Bang, backwards. And so he obviously he didn't miss the rest of the season. He didn't have a major knee injury. But these guys walk around with injuries, you know. There's a lot of wear and tear on their bodies. So let's see. So you can see him. Man, he doesn't look injured at all. And I don't have the footage from today's game, but you could see like on the sidelines, he traveled to Chicago. He was getting up. He was cheering, and you could see. Hold on, let's go back. Look, you can see in the hallway. He's walking fine. And so let me go a little bit deeper into this to show you guys. So what happens is this is actually the outside of the knee, right? So what happens is somebody say it's not how Khris did it. Say it's like the typical way where somebody puts force into this knee, and it breaks this cord here. This is what we call a ligament. It connects two bones. So tendons connect muscle to bone, and ligaments connect bone to bone. And so this gets torn, and so this in this picture is depicting a clean tear or a complete tear. So this would be technically a grade 3. So this is either depending on who you are, a surgery, or you're in a brace for 3 months maybe if it's really bad. And you can kind of see here. So normally it's just like it has straight edges on the side. And the grade 1 sprain just means that there's like small internal tears at different levels, right? Grade 2 is that it's partly torn. And this picture is just like a simple picture. So like it's not really showing you exactly what's happening. I'll show you what's happening. And then grade 3 is complete tear. So this is an MRI. So this might be a little bit outside of a lot of people's wheelhouse of looking at, but let me walk you through it here. So you see this line here. So this is technically the MCL, and the MCL has many layers. So this would be probably the most inner layer. So you can see it's running here, 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 and then over here it's turning white. And why is it turning white? Because this is fluid from inflammation. So whenever you tear something, I don't know if you guys have had a knee injury before, but if you had, you would know that your knee swells up right away. It's like a balloon. And so what happens is fluid from the other parts of the body come in. They bring it. Fluid is brought to this part here, and a lot of other things that help you heal. And so it'll show up white. So you can see here, even though it's a straight line, it's kind of zigzaggy. And you can kind of see here that like that's what's happening. It's tearing, and it's not taut anymore. It's not tight, and it's supposed to hold these two bones together really tight. Here's another illustration. So you can see here that this is maybe simple because technically this MCL or tibial collateral ligament, as it's depicted here, is 3 layers, and the deepest layer goes all the way down to that thing, and that's the meniscus. And if you're a basketball fan, you know very well that this is an issue. So the reason why I'm saying I don't think it's a serious injury is because on the MRI, this picture that they had today for Khris, they would have seen if there was a meniscus injury. They would have said, "Oh yeah, he's done for the playoffs." Maybe, probably, or they would have seen pretty much nothing, and they say he's back in a couple weeks. And then just for reference sake, let's go into the deeper injuries here. So you can see on this grade 2 that like one of the layers, because I said there's multiple layers, one of the layers is torn, but the other outside layers are intact. And so there is some damage here, but if this was Khris, which is probably the worst case scenario in this situation, he'll be out to the Eastern Conference Finals. But I mean, you guys saw Giannis in the finals last year. That guy was playing hurt, and Khris saw that. He'll play hurt. So, to be honest, if the second round went 7 games and he had a grade 2, he'd probably be back. Now, grade 3 is a different story. So you can see here. Let me try to zoom in here. Yeah, that works. So you can see how this white, like I said, that's like inflammation and fluid. It crosses the whole thing. Now these two pieces are actually really close to each other. So this, if this was Khris, there'd be a good chance that maybe even without surgery he'd be 100%. Since he's an elite athlete, I would say that he'd probably have surgery. I mean, it depends on his personal doc and the surgeon and the team doc, but he'd probably have surgery. But he'd be done for this for the playoffs unless he was like a super G or just did not care, just wanted ring number two. But I don't know. I've never seen anybody really do it. So this is the thing with MCLs here. So let's see. So let's switch back. So let me just kind of tell you guys what I think. So like with the MCL, it's going to heal quickly. So like a grade one, which is just like stretching, is probably like a week to 2 weeks. Grade two is like 2 to 4 weeks. Grade three is like up to 6 weeks, depending on what's going on. If there's surgery, obviously longer or shorter. I mean, it kind of really depends on what's going on in terms of like the doctor, the surgery, and the follow up and types of therapies. One thing that has been tried is something called PRP. And so what happens is people get PRPs injections, and I can go into that in a further video, but let's not go too deep because it probably doesn't. He probably didn't get PRP, to be honest. So PRP is like a way to heal quicker, so-called way to heal quicker. I don't know. Zach had a good experience, I hear, or at least it's been reported that early this year with his knee, but he's still injured. You could tell. Yeah. So that I'm sorry, that was a tangent. So they could do like more advanced therapies if they're really desperate, but really the research has shown that you don't really immobilize that person. You go tell that person, as long as there's no really risk of further damage, which there isn't, to just don't don't do any sports, but go live your life. Stretch out that knee, because the research is saying that people that walk and move around actually heal stronger than people that are in like casts and they can't move the knee at all. So this is not a situation, even if there was some damage, that he would be in a cast unless there was more damage. And you know, I don't think I talked about it. Yeah, no, I did talk about it. The meniscus can be injured. So what happens is this is the medial meniscus, and this is connected to the inside layer of the MCL. So if this gets torn, this can also get damaged, and an MCL injury. I mean, the meniscus injury is obviously a lot more severe. All right, guys. So that's my take. I think they're not really. I think this is a big middle finger to the Bulls. I think they're saying that there's going to be no Game 7, and so he's done for the series, and he'll be back in the second round. If not, then they would be reporting something else, to be honest with you. And I've been around this. I've seen it. Like he is definitely he's on his way back, guys. All right. So thank you for listening and watching to my first video. I appreciate all you guys. And like I said, please just subscribe and like the video. I really appreciate it personally, because I put a lot of effort into this video and getting this channel up and running, and I really want to see it grow. To be honest, I'm going to be honest with you guys. I think we can hit 1 million within the next 365 days. I really do. And I'm asking you as a friend, subscribe. Take care. I hope you guys have a great day or afternoon. Take care.